to retire. There's always something that you can do to help people, to provide information, to share information that you've gained throughout your career. So after working a little bit with the World Health Organization, helping them draft some guides to help people in the purchase of technologies, I was involved in some of the work that they were doing around a hearing report that came out in 2021. And in this report, it brought out some things that countries around the world need to be considering and doing in order to help people with hearing impairments, with hearing loss, hearing difficulties. So one of the areas was cerumen. Cerumen is what we call earwax. And so this is, let's see, I have to find the buttons here. They're not lighting up really clear for me. There we are. Cerumen is something that people are often, sometimes a little bit appalled by it, saying, "Ooh, I've got earwax in my ear, I need to get it out." And I'm going to give you some information here today to basically take away that myth that cerumen needs to be taken out of the ear. It's a natural substance. It belongs in our ears. It's only a concern when we don't have any of it or we have too much. So let's go ahead and get started here. We're just going to do a very brief ear anatomy. And here I've just put up a picture, and I've highlighted two areas with the red lettering and the yellow and purple marker. And so if we're looking at the ear, this is the outer ear that we're focusing on, and the ear canal. The ear canal, on average, is about 25 millimeters long. It's only about 6 millimeters wide. So it's not a very long or very wide tube. Of course, this is an average, differs from person to person. And there are two major sections that we are concerned about, or we look at, when we're talking about cerumen or problems that people might be having with their cerumen. So one section is what we call the bony portion. So this is the portion of the ear canal that is closest to the eardrum, and where it is strictly skin on bone. And so this is an area that is very sensitive to the touch, and something that those people who do work in cerumen have to be very conscious of and be careful not to bump up against it. Otherwise, a person might experience some pain or discomfort. The other portion is called the cartilage portion, with the purple. This is where most of the action takes place with cerumen. This is where the glands are that produce the waxy substance that we call cerumen. So this is the area where, if we're going to start to experience difficulties, this is where the clinician or the doctor or the nurse is going to be focusing on. So if we look at wax production, there is about 1,000 to 2,000 glands in everybody's ear canal. And they're attached to little hairs that line the ear canal wall. And these are the glands that secrete the substances that make up cerumen. So we don't have to get too worried about the medical terminology here, but there are ceruminous glands and sebaceous glands, and they both secrete substances which travel up the little hairs in the ear canal and into the ear canal. And so it's this mixture of substances that makes up cerumen in our ears. That ear canal that we looked at earlier, from the tympanic membrane, the eardrum, out to the opening of the ear, the skin that lines that canal is actually a small little conveyor belt. As the skin grows, it starts to migrate out towards the opening of the ear. And this conveyor belt that we all have brings the cerumen and any other debris that's in the ear out so that it can be expelled out of the ear canal, thus not having it get too blocked up or plugged by these materials. Now you can see, based on the slide that I've put here, that it takes a very long time for the skin to migrate and to bring all of those substances to the opening of the ear canal where they will be expelled. So when we're talking, as I'm talking now, or we're chewing and eating, this also aids in that migration. So typically, we would expect that when cerumen is first produced, it will exit the ear canal in 6 to 12 weeks, typically, for a normal individual. When that cerumen is not exiting the ear canal, however, in that 6 to 12 week period, it may start to build up to the point that it becomes a problem where it begins to block the ear canal opening. And depending on the individuals, it could lead to some fairly serious conditions. Often it's, though, more of a nuisance. So here's another slide to look at the composition of cerumen. We've already talked about it being the secretions from those ceruminous glands and sebaceous glands. But there's actually over 40 different substances that can be found in cerumen that go into making this compound. We talked about the fact that it does migrate, and the purpose of the migration is to bring the cerumen and any debris, any objects, anything that's been embedded in it to the opening of the ear canal so that it can be wiped out or just fall out of your ear if you've ever experienced that yourself. The cerumen is also something that acts as a moisturizer, and it's also a deterrent for foreign bodies entering the ear canal so that anything like a dust or dirt, maybe even an insect, would become stuck in this waxy substance and not be able to get down the ear canal into our sensitive portion, the bony portion, and the eardrum. Now, there was always a belief that cerumen had properties to protect people against ear infections, and this is not true. Actually, cerumen and the compounds and everything that's sitting there in the ear canal can act as a beautiful medium for infections to get set up and grow. So the actual deterrent for infections happening in the ear canal are actually the cell walls, the cells in the skin that have their antimicrobial benefits or are the things that help to prevent infections from setting up. But I'm sure many of you who are listening or who will listen later on will say that you've had some form of an ear infection at some point in your life, either as a child, a middle ear infection, or older adult or an adult where you've gotten an infection after swimming or some other activity. Now, the way that cerumen is secreted, the amount that's secreted, and the look and the feel of it, whether it's white, wet and sticky, or dry and flaky, these are really hereditary characteristics. So a lot of the way that your cerumen looks, feels, and acts is based on your heritage, but it also can be environmental. So the cerumen, when it's first excreted, doesn't really have much coloration. It usually is just a little bit of a brownish tinge to it. But as it sits in the ear canal, is exposed to oxygen, it will oxidize and darken. Also, if there's debris floating in the air, this might be collected in the cerumen. So people who work in construction, if we look in their ears, they'll often have what looks like very dark cerumen. That's because they're working around a lot of dust that's in the air, and that is going to, again, eventually enter into their ear canal and get caught up in the cerumen, which, again, is what the cerumen is supposed to be doing, providing some protection in foreign bodies or foreign object coming down the ear canal, catching them early if at all possible. Okay, there we go. So let's look quickly here after we've got the production of the cerumen. What happens if you're one of those individuals who produce too little cerumen? Having no cerumen is not good. Having too little cerumen can also be a problem for some people. And if we look at what the possible causes are, usually it could be, again, to genetics, but also the overuse of Q-tips. And we'll talk a little bit more about those later. But Q-tips, people who overuse them take away the wax, and so they lose the benefit of what the wax is there to do for them. People who have too little cerumen in their ear can often end up with ear infections, external otitis as we call it. It can cause problems for them if they're wearing hearing aids, where they're wearing the type of hearing aid that has a full ear mold or is a custom hearing aid. Their ear is so dry without any lubrication that they have intolerance, discomfort from their hearing aids. It certainly can lead to dryness and itchiness. And of course, those foreign bodies we talked about earlier, the dust and other things that could come in, there's nothing there to stop it. It's just going to enter in and work its way down the ear canal, which is something that can be problematic. On the flip side, we've got individuals who produce too much. And so for these individuals who produce too much, we need to sometimes do some form of intervention to reduce the amount or control the amount of cerumen that's in that person's ear. Why might this happen? Well, some people have smaller ear canals. Remember, going back to the first slide, we had the average size for an ear. Well, there are people who have very small ear canals. And as such, when they produce the cerumen, it may build up quickly in that smaller space. They can't shed it fast enough, and so they'll end up having a lot of excess cerumen. It can be part of the aging process. As we get older, we produce more wax. And theories on that is that the skin is a bit drier, and so the body is trying to lubricate it and keep it moist. And so the action of the cerumen buildup increases. Also, I think it may have to do with that migration effect that we have in the ear canal, where things just aren't moving as efficiently as they did when we were much younger. People who use cotton swabs, the Q-tips, or do excessive ear cleaning, this can sometimes trigger the body to want to produce more wax to compensate for the lack or the fact that the wax is being removed. Individuals who wear hearing aids that are custom built or the ones that have the full ear molds often can create some stimulation of the glands in the ear, and thus that can increase the amount of wax that a person will produce. Those individuals who've had some radiation treatments for the head and the neck, the radiation can impact the cells of the ear canal wall and thus create problems with the overproduction of cerumen. And then, of course, those are individuals who have hypothyroidism that can also increase the production of cerumen. So next to that, you see the symptoms, long list of possible problems from having too much cerumen, to one what we often run into where it's completely blocked the person's ear canal. And so they've got like an earplug that they're wearing all the time. Sometimes the cerumen can build up so much that it actually causes pain for the individual. It may cause some itching. Hearing loss we talked about already, that just be like an earplug. And so if you've got problems hearing already and you now have a cerumen plug, you've added additional impairment, additional reduction of what you can and cannot hear. There are people who have severe impactions that causes them to feel dizzy, bring on tinnitus, the ringing in the ears, and other possibilities, infections. And so we do need to be cognizant of cerumen in the individual's ear and address that if there's too little or too much. So now let's look into an ear. And so if I'm an audiologist and I'm in my clinic and I'm looking into someone's ear canal, I'm hoping that I'm going to see a nice clear canal that allows me to look right down at the tympanic membrane. So there you see 4 views of normal looking ear canals and eardrums, and then a couple of those middle slides, the middle picture, so you can see that there's a little bit of like a brown ring. So that's some of the cerumen that's in the individual's ear. It's just a nice amount. It's going to do what we want it to do. And so this would be what we would hope to see every time we look into somebody's ear canal. Unfortunately, that's not what we always see. Sometimes we're going to be looking down the ear canal with our otoscopes, and this is what we're going to see. We're going to see either a big block of cerumen that's wet or possibly dry, that's really dark in color or lighter in color. So these are some of the views that we might see if we're looking at somebody who's complaining that they feel like their ear is full or plugged up that there's something in there or that they've got an issue with the wax. Of course, when we've got wax to the degree that's in these pictures, you cannot see the tympanic membrane. So as an audiologist, as a hearing instrument practitioner, as a doctor, this is not good because we do not know what is the state of a person's eardrum, if there's a problem with their eardrum or whether their eardrum is clear. So this is when we need to address this type of a situation and remove this cerumen, get it out of there so that we can complete an examination, do a fitting of a hearing aid, or the individual can just go about their day-to-day activities and hear to their very best potential, because that one with a very dark plug, that would really be something that probably is causing some hearing loss due to the blockage of the wax. So what is the number of individuals in the population who have cerumen impaction? So this is a report, that World Hearing Report. It came out in 2021, and these are the statistics that they published for us. And so the general population, we can expect that there's going to be about 6% of the general population who have cerumen impaction. That's a lot of people. Cerumen impaction is not a rare condition. It's very common. Of course, when we look at people who are using hearing aids, we would expect that 19% of those individuals are going to be experiencing difficulty with cerumen and having cerumen impactions. As we talked about earlier, as we age, there's more common to have problems with cerumen production and expulsion. So older adults are more likely to have cerumen impaction, 35% of the general population. And then there's a number of 57% seniors in long-term care. So those individuals who are living in intermediate care facilities, senior residence, places like that, there's a very high incidence of cerumen impaction that really does need to be addressed in some systematic way. Right? So big problem, lots of cerumen out there that needs attention. So who would people go to? Who has cerumen management as part of their scope of practice? Well, of course, we'd expect an ear, nose, and throat doctor to have the knowledge and ability to deal with cerumen. Typically, people will go to their GP, the general practitioner, the family physician, if they're having problems with cerumen. And then the doctor may either try to take the wax out themselves or have their nurse do it. So nurses have cerumen removal in their scope of practice, but so do audiologists and hearing instrument specialists. Now, in British Columbia, for an audiologist or a hearing instrument specialist to do anything with cerumen that people come into their clinics with, they have to hold a special certification from the college that ensures that that individual has the knowledge and the ability to deal with cerumen appropriately. So not every audiologist, not every hearing instrument practitioner has this certification. It's something that's rather onerous to acquire from the college. So there's a number of steps and procedures that an individual has to go through. But once that individual has this special certificate, then they're allowed in British Columbia to start providing cerumen management services. Wherever you would go to have cerumen addressed, if you had a problem with cerumen, for audiologists and hearing instrument practitioners, and I'm sure it's for other medical specialists as well, we have to always get informed consent from the individual before we attempt to remove the cerumen from somebody's ear. As we'll talk about here in a little bit, there are some risks in having cerumen removed. They're very uncommon, but people do need to know that there are some risks involved, and they do have to be able to give consent to the practitioner to have the cerumen taken out. But what's important to know in the definition of informed consent is that it can be removed at any time during the procedure. So if you felt uncomfortable about the way the clinician was going to be taking the wax out of your ear, or you started to feel really uncomfortable or uneasy about the cerumen being extracted, you can just say stop, and immediately your consent has been withdrawn, and the individual must stop and then advise you or make other recommendations how to deal with the cerumen. So part of informed consent, it's important to know that you can withdraw this consent at any time, but that there are consequences. So if the cerumen hasn't been able to be taken out, or you won't allow it to be taken out for whatever reasons, that there are consequences to that, whereas treatment, an intervention, a hearing test, whatever, may not be able to be completed, and so that the cerumen does need to be addressed at some point in time. So this was just from a form that I produced with another colleague. We have a course that's online for professionals to take to learn about cerumen and how to address it properly. And so this is some of the risks that we want people to be aware of, that if they're going to have somebody take cerumen out of your ear, whether it's the nurse, the doctor, the ENT, the audiologist, hearing instrument practitioner, that there is some risk. So there is the potential for a little bit of bleeding from the ear canal wall if the wax is adhering very hard to the skin and is being pulled away, and it causes a little laceration. Or the instruments that are being put into the ear canal, the clinician inadvertently scrapes the ear canal wall. This can cause another little laceration or hematoma, a little bit of a blood blister. There is the potential, I've never run into it, where I personally was involved with damaging somebody's eardrum. As an audiologist, I do have a number of stories where people went to clinicians who really weren't knowledgeable about how to remove cerumen properly, and actually had their eardrums burst because the individual was using water being forced down the ear canal and wasn't doing it properly, and the pressure of the water in the ear canal actually caused a perforation of the eardrum. Very rare, but it does happen. And again, we do want people to be aware of these risks and have their consent before we proceed. I'm not going to spend time on this slide much at all. This is just things that if you're somebody who's providing cerumen management services, you must be aware of, because some of these conditions that are listed on this slide require that an individual be sent for medical intervention or to be seen by a specialist because a problem has been identified that needs medical attention before the cerumen could be taken out. Other conditions on this slide would be ones where, as a clinician doing cerumen management, would say, now that I know this is the situation, I need to modify how I'm going to take the cerumen out of somebody's ear. So these are just the many things that the clinician who's licensed, who has this special certificate, must be aware of and are aware of, so that they're going to make sure that they're doing the cerumen extraction in a very safe manner with all the bases covered. So now, with the time we have here, I just want to show a couple slides of actual conditions of the ear where the clinician would have to recognize that there's a problem and that they would not want to proceed with the cerumen extraction, but they want to actually do a medical referral. So this picture here that you're looking at looks like some of those pictures we saw earlier, that, oh, this person's got a complete blockage of cerumen. But upon closer inspection of what this substance is that's in this ear canal, this is actually keratin that's being secreted by the tissues of the ear canal, and it's being secreted at such a rate that it has caused a buildup and a blockage. So this is keratosis obturans, that's the medical term for it. And so this is a condition that if I were to see this, I would not attempt to remove it. I would immediately refer this individual to their family doctor, who may then refer to an ear, nose, and throat specialist to have this addressed, to investigate why is this happening in this particular individual's ear. This is a very rare condition, but these are some of the things that we need to be aware of and cognizant of so that we're not stepping beyond what our scope of practice would determine or be appropriate to. Ear infections, this is something that when I worked with in public health, where we saw a lot of children and see this on a weekly basis, individuals who have middle ear infections. And so anybody who has an active middle ear infection, cerumen should not be cerumen removal should not be attempted, except maybe by the ear, nose, and throat physician. Typically, we would want the ear infection to be cleared up first, and then the wax to be taken out after the infection was cleared. Here's some other conditions looking down the ear canal. So this is otitis externa. Remember, we talked about people who don't produce enough cerumen might end up with some irritation of the tissues. They could get some infections that set up. So these are all things that, as a clinician, if I'm looking into somebody's ear because they're saying, I think my ear's plugged up, might have some wax, I need you to take out. And I look in the ear canal and I see these types of pictures, these types of views, I'm going to say, no, you know what we're going to do? We're going to send you to your family doctor. You've got a medical condition that needs to be looked after before we can address anything about your cerumen or really anything about your hearing. I would not even be doing a hearing test on an individual who would have an ear that might look like this, where they have an external infection. And of course, I can tell you, I do have those stories of looking in somebody's ear canal where they thought they had earwax and it was plugged up. And what they actually had was a foam dome, foamy or something that they stuck in the ear or got stuck in their ear. And on occasion, I have removed a couple of insects that had crawled into people's ears. They died, but were just sitting in there causing accumulation of materials. And so these are things that are extremely rare, but they do happen. And so these are things that we would be also cognizant of and need to remove appropriately. These take a little bit of different approach, a little bit of different tools that would be used in order to bring those out of somebody's ear. So when we're looking at cerumen removal, so if you have impacted wax and you need to go and have it addressed, there are three different methods that are used by clinicians to take the cerumen out. One is irrigation, so that'll be using water. The other one is using manual removal, so you're using a little bit of what we call a curette to go into somebody's ear to bring the wax out gently, or using suction, which is usually what is used by the ENT doctors and being used more and more by audiologists and hearing instrument practitioners. It's really, to me, it's the gold standard. But with any of these three methods of removal, there are risks, different risks involved. There's also when they are more appropriate to be used and when they are not appropriate to be used at all. We're going to take a look at that in the next few slides. So these are our three methods that we have for removing cerumen from somebody's ear. Now, this is the slide. I'm not going to spend a lot of time going over all these points because this is this training slide. So remember I told you we developed a course for professionals, for clinicians to learn how to take care of cerumen properly. And so this is the one that we prepared on irrigation. But we can look and see that the advantages and disadvantages of using irrigation, this is where the clinician needs to know when this is an appropriate method to use, is that it's the easiest one to do. It can be messy, but people usually don't find it uncomfortable to have it done. It's relatively quick and easy as long as the cerumen isn't too hard and too much of a solid impaction. But this is the one that I can tell you I have stories of one not that long ago, really just in the last year, where an individual's eardrum was perforated by someone who was doing irrigation improperly. They didn't know what they were doing, they didn't realize what they had done, and they had caused some significant damage to an individual's eardrum. There are certain individuals that you cannot use irrigation with, individuals who have diabetes or have severe immunocompromised conditions. Using water in an individual's ear, unless you're extremely careful about drying that ear when you're done, these individuals are set up for possible infections. And as their bodies don't deal with infections well, we do not want to be introducing a medium that might lead to an infection being set up. Also, if somebody had some of those other conditions, the pictures we saw where they had the external otitis, the external infections, you would not want to be irrigating those types of ears. So this is where the clinician does need to know when irrigation is appropriate and when it is not. It's not for everybody. Unfortunately, when you go to see your doctor and the nurse is going to take the cerumen, it's almost 100% irrigation. So there's some issues there where they're not using sometimes the current best practices for cerumen removal. Manual removal takes a little more skill. You have to go in with an implement into somebody's ear, and as we know, it can be often very sensitive in those ear canals. But if the clinician is skilled, and hearing instrument practitioners and audiologists they spend all day in people's ear canals, basically. So they really are knowledgeable about how to approach the ear canal, how to go in and gently, carefully remove cerumen that's accumulated in the ear canal. It's not really good to use if the cerumen is very deep. If somehow it's worked its way down into the bony portion of the ear canal, then that's where the clinician might be a little bit hesitant and maybe wouldn't want to go in with an implement to go too far down where the ear is real sensitive and getting close to the eardrum. But this is a method that is readily available in most clinics. It's very portable, so if I'm out doing calls, I don't have to have a big piece of equipment. I can just use these little lighted curettes that are disposable and take care of most situations with cerumen. So this is one of the more popular methods, more common methods. And then we have the microsuction. So this is what you'd experience if you went in to see an ear, nose, and throat doctor. They're going to use suction almost 100% of the time to get the cerumen out. And more audiologists and hearing instruments practitioners are going this route because, again, it's really a good method to use for getting cerumen that may be deep. It also is a method that is very effective at bringing out wet cerumen or even dry cerumen. All types can be suctioned up with the nozzle that is put down the ear canal. Some people don't like microsuction though. It's noisy. It sounds like a vacuum that's going off in your ear. And there are individuals who maybe suffer from tinnitus where loud sounds or this might make their tinnitus worse. So again, microsuction is something that is really considered the gold standard. However, it's not for everybody. So again, the clinician needs to know what method is going to be the most appropriate for the individual they're working with, and what is the one that the person will give consent to. Again, remember, go back to informed consent. This is part of the consent. If you say, I just don't want you putting water in my ear, you have to do this a different way. Then the clinician needs to go to their number 2 or their number 3 method that they have and address the cerumen in that way. Okay, so those are the 3 major methods. Now, what are some of the methods that we do not recommend for removal of cerumen? Well, number 1, and I can't believe it's still out there, but it is something called ear candling. This is quackery, pure quackery. And so this is something that has been disproven scientifically. Health Canada has an alert out on this that you do not want to attempt to use ear candling to remove cerumen from the ear. It will not work. In fact, you're going to set yourself up to actually have a burn or damage, debris from the burning candle going into the ear canal and causing all kinds of difficulties all kinds of problems. So ear candling, definitely no. Q-tips. Yeah, we've heard this. Never put anything bigger than your elbow in your ear. It's true. You do not want to go down the ear canal with Q-tips. What ends up happening, well, two things. You take out all the wax, which we've already learned is a problem if you don't have enough. But more likely, you end up taking the wax that's there and pushing it down the ear canal towards the eardrum and just packing it down so that it just becomes the hardest plug that you would ever imagine and becomes something that is really quite difficult then to get out. It's going to take a lot of work to get something that has been really packed down into the ear canal. So Q-tips are a no-no. All right. So what about prevention of cerumen buildup? So as an individual, you say, well, what can I do to help prevent my ear canal, which I tend to get some wax buildup? How do I prevent that from occurring? Well, my first recommendation is see a clinician who's got the proper certificate to look at your situation and determine what you really do need. And if you are a candidate for being able to do some things to look after your own cerumen buildup and to try to keep it from happening. So there are eardrops that you can get at the drugstore. Some of them are quite harsh. Others are okay. I would always recommend if I thought somebody needed to do some softening of their wax at home before they came to see me to have me attempt to take it out, is I would often recommend that they just use some olive oil or some mineral oil. The earwax is very absorbent of any kind of fluid. So anything that's liquid you put into the ear canal, it will be absorbed by the cerumen. And it will cause it to solidify and soften and make it easier to come out or come out on its own. But there are drops that are recommended by the pharmacist that you could talk to, or maybe the clinic that you attend. They may sell some ear drops that can be used for softening earwax. Irrigation bulbs are things that you can purchase too. These kits where you're going to get water and you're going to squirt it down your own ear. I don't really recommend that. Again, unless you're going to really make sure your ear canal is dried out properly, you might be setting yourself up for an infection. So, yeah, self-care. I would first talk to a clinician about what your needs are, and then set out a care plan and determine whether you come in to see them on a regular basis for cerumen removal, or you're able to do some things at home to help keep it from building up. So this is from the American Academy of Otolaryngology. They actually have this nice little handout, which I think you'll be able to access from the presentation, that just has some helpful prevention choices and things I just talked about. And then it talks about the things that are not advised. And there's the ear doctor saying no ear candling. These are some of the different types of cerumen softeners that are out there. You can order them online. You can go to the drugstore, pick them up. Again, I would recommend going into your hearing healthcare provider and asking them what their recommendation would be, what experience they've had with the different types of softeners that are available. As I said, they all work pretty much the same. So you want to make sure that you're going to get one that's not going to harm your tissues, that your body will tolerate. And again, coming back to olive oil and mineral oil, those are things that are pretty safe to use for everybody. You're not going to use a lot. You're just going to use a few drops to soften the cerumen. It's not something that you have to put in your ear all the time in large quantities. It's just a few drops. If you do use water, or if you're a swimmer and you want to make sure your ear canal is dry, there are some things that you can look at. One is just getting a little piece of tissue and wadding it up and just sliding it down the ear canal to absorb the water. One of the concerns I have about that is sometimes the tissues will break apart, and so they might leave a little bit of tissue behind. There's a better product. It's called After Swim. This is something that's available online, but it's also available at swim shops. So wherever people who are swimmers, they can go and get their swimming supplies. The after swim would be available. This is a highly compacted piece of sponge that's tapered to go down the ear canal, and then it absorbs any of the moisture there, makes sure that it really dries the ear out properly. Or you can get your own little personal ear dryer. Again, they're online and sometimes available at drugstores. They do work. They do work. They just gently blow some warm air in and out of your ear canal, and that helps to dry it out and keep the health. Last couple slides here as we come to an end. So cerumen management, I think if you have an issue with cerumen, it is a concern for you, you should set up a cerumen management care plan. And so this is where you want to look for a clinician who has the certification from the college to deal with cerumen. And you say, well, who is that? Well, you could ask around and see if your clinic that you go to, they have the appropriate certificate for cerumen. If not, if you go to the college's website and you do a search, just put in the word cerumen in the search box, and it will come up with a list of all the clinicians in your area who have the advanced certification for cerumen removal. And so then you could go and talk to one of those individuals about a possible care plan or having the cerumen removed. Often you may end up having to pay for that. If you go to a family doctor, you're not going to pay for it. It's covered by our medical services plan. But you'll find that most doctors are not really keen to want to do it. They may end up referring you off to an ENT to have it done, and it's just going to take a significantly longer period of time to get the cerumen addressed. Whereas if you go and see an audiologist or hearing aids practitioner who's certified, they'll be able to address it right away, and they're going to address it in as good, if not better, than the other healthcare providers. Right, so if you're coming in to see me, it may be that you just have a one-off removal that's required. You may need ongoing self-care, ongoing professional care. So maybe you need to come in to see me on a regular basis, every 3-6 months to have the cerumen taken out. Or I need to refer you for medical intervention because your cerumen situation, your ear canal, whatever I've assessed, I'm not feeling comfortable with handling it, and I'm going to refer you on to potentially an ear, nose, and throat specialist who are going to have those really advanced surgical skills that might be necessary. Okay, so that's it. That's enough about cerumen, probably more than you ever wanted to know. But now we're just going to open this up and see if there's any questions. So I'm going to go ahead and stop sharing my screen. That's the button. And come back and see if there are any questions that anybody has.
Yes, you can use the Q&A tab there at the bottom to type in your questions.
While we're waiting for questions, I know people are often curious about, well, if I go to get the cerumen taken out by an audiologist or a hearing instrument practitioner, what might that cost me? And I have to say, I've seen prices that people will charge, it might be $35 per ear to as much as $150 for 2 ears. It can vary. It just depends on the clinician that you're working with. I believe in some jurisdictions, like Ontario, you can't even really go to see your family doctor any longer for cerumen because they can't bill for it. So you can go see them, but they may turn you away because in Ontario, for whatever reason, they dropped coverage of cerumen removal from their medical services plan. They haven't done that in BC, although I think I understand that they may have reduced the amount that the doctor can bill for. So they're a little more reluctant to want to spend time dealing with people's ears, which is unfortunate.
All right, we have our first question, which is how often should one add oil drops to one's ear?
Right, so this is part of that care plan that you need to have. working with the clinician, you'll determine that maybe you'll just do it once every 2 or 3 weeks. Maybe you're going to do it for a number of days in a row because you have some cerumen that needs to be softened before the clinician can attempt to take it out. If you're looking at using it just as something to say, oh, I just want to maintain my ear so that I'm not building up wax, then it's probably going to be very infrequent. Maybe once every 3 to 4 weeks, you'll put a drop or two. That's it, not a lot more than that, into your ear canal to just kind of keep things softened and keep things moving out. Of course, you know, if you're wearing hearing aids, you're wearing a receiver in your ear canal, and now you're going to start putting a lot of oil in your ear, you're going to cause problems with your hearing device. So this is something, again, I recommend talking to your clinic that you go to about how often you might need to have drops put into your ear.
All right. Susan says no questions, but this has been very useful. Thank you so much. Thank you, Susan. Next one, I was told to let shower water in ear to rinse out the ears after using olive oil.
Okay, water and oil, it might rinse it out. I would say get something like the after swim, or using a little tissue that you just wad up a little bit and just insert it into the ear canal and let it absorb any of the excess oil or anything that might be in there. Putting water in your ear sounds like a good idea, but you're just setting yourself up for the potential of having an ear infection if you don't dry your ear thoroughly. I swim a lot, and I try to dry my ears really well, but every so often I get a little bit of infection in the ear canal because of the pool water. I picked up some bacteria or something. So it's just one of those things that you keep water out of the ear as much as possible, actually, unless you're going to have the right tools to dry your ear properly so that you're not setting yourself up for a potential infection.
Okay. Rose says, at times my ear will feel like it's releasing fluid and actually does.
Releasing, oh, okay, so do you have an ongoing infection or a perforation that you have an infection in the middle ear? Some people's wax is very fluid, and so they actually will just, you can look in their ear and you can actually see wax just a little wet coming out of the ear into the concha, the bowl. But for a discharge, something like where you have a discharge of fluid, that's something I would probably want to have my hearing healthcare provider take a look at and see what that's all about, because I'm not sure what's going on there.
Okay. Our next question, if an audiologist or hip or medical doctor uses irrigation, what should be the disinfecting methods for the equipment for the water syringe or bottle?
Yeah, well, this should all be sterilized equipment. And so for clinicians that I know that use irrigation, they will put on a disposable tip so that once it's done, once they've completed the procedure with the individual, that tip is removed and thrown away. It should never be put into anybody else's ear. There's no way you can clean it properly unless it is something that is made of metal and it's put into an autoclave or put into a solution that will take it to a point of sterilization. It should not be put into somebody else's ear. And so that is something that anyone who has been certified to do cerumen removal, that's a part of their training. What is the appropriate methods for infection control? Because cerumen is an infectious, could potentially be an infectious agent. It can have blood. It can have other things embedded in it. So as a clinician, I have to treat it as an infectious substance and make sure that I'm using appropriate infection control for my safety, for the individual safety, and for the safety of the other people who come into my clinic for services.
Okay. Sudden relief of severe earache. Does that indicate that the drum has burst?
Who knows? That's where you only would know if you really looked in there and saw what had happened, whether or not there was a rupture or whether there's an acute infection that's suddenly popped up. Yeah, there's no way to know unless you do a proper assessment investigation of what's going on.
Okay. And does use of hydrogen peroxide tend to dry out the canal too much?
Yes, it does. Yeah. So hydrogen peroxide, you'll see some places where it's recommended to use. It does, have a bubbling action, and it can help to break up a cerumen plug, but it's actually a pretty harsh chemical. So it can be pretty hard on the skin that lines the ear canal. The skin that's where in the bony portion, the deep portion of the ear canal, it's incredibly thin. It's skin on bone. And so it's very sensitive to touch and for other substances. So hydrogen peroxide is not something that I would recommend. You will see some drops that are available from the pharmacy where hydrogen peroxide is part of the chemical mix. And I usually tell people to avoid those. They're not my go-to. There's better solutions.
Okay, great. And I heard we have some more questions in the chat from IDHHC, the boardroom.
I'm just going to unmute us here,
Yeah.
Carmen, and I'll ask it. How important is it to have cerumen removed from an ear that has some inner ear or middle ear damage?
How important is it? That's something that, for myself as a clinician, if I was doing the removal, I would not attempt to do unless I had medical clearance. So either the person's family physician or the ear specialist has given me the all clear to go ahead and do cerumen removal because the condition is known. They know I know what I'm doing. And so I would then need that medical clearance before I would even attempt to do cerumen removal. But if you've got excessive cerumen, if you've got cerumen impaction, it needs to be dealt with. It can't just be left there indefinitely. So whatever the condition that the person has with their ear, cerumen impaction needs to be addressed, but it needs to be addressed appropriately. So this is where sometimes it needs to be done by the medical specialist only, or you're working in partnership with a medical physician and you've been given the all clear to go ahead and do a particular type of removal. Because again, we're going to have to look at what's the most appropriate removal procedure to use. And in a situation like this, irrigation would never be used or considered. It would only be suction or manual curettage that would be used by the clinician. So lots of caveats there in that kind of situation.
Okay. And then Leslie would like to let us know that in Victoria, they were able to have their ears cleaned at James Bay Urgent Care Center by a nurse.
Mm-hmm.
And that this has been very informative, so thank you.
Well, my pleasure.
Okay, any last questions? We are wrapping up on our time here. Doesn't look like it. If you guys want to see this again, it has been recorded. We can distribute the recording. And we just would like to say a really big thank you to Dan. This was great. Really appreciate you sharing your knowledge with us.
Well, my pleasure.
All right.
Okay.
Thank you.
Welcome. Enjoy summer, everybody.
Okay. Bye-bye.
Bye-bye.